was so much more involved than just getting locums there and having a new compensation package. There were so much work on what I call culture. We really had to address culture. And so I spent hours with all of my practice partners, getting them over to, leaving that autonomous, independent practice to a health system. And again, I joke, I have a master's in health administration and probably should have got one in counseling. And so again, just hearing them out, listening to them, and then identifying what we could address, and then being transparent in what we couldn't. And we had town halls, we met weekly, we made all these things visible. And I'm so glad to say that only 2 decided not to stay. So we had a great success there. And then about 4 months into this employed model, I took a big risk. And what I did with them was, hey, I want you to come up with a mission and vision statement. So I really wanted them to own their culture. So they did this. Our leadership did this within the anesthesia group, and they came up with a mission statement. And again, we were very intentional. I was involved, but we used a phrase called world class. And I know that phrase gets used all the time, and it lacks its luster, but it really stuck. It was a North Star for this team. They were able to compare all of their problem solving, their tests of change, etc., to this North Star. And it spread. And I'll just give you 2 quick examples. I was at a public speaking event with our board chair. I can't even remember what he was talking about. And this was probably a year or 2 after we formed our group. And he was referring to some of our groups in our health system. And when anesthesia came up, he said, world class. And then finally, patient experience, Press Ganey, those are always top of mind. As soon as we made that mission statement, I kid you not, month after month, our patient experience scores improved. Like 36 months in a row. I'm not kidding. I can show you the data. I think that's our patients telling us we're world class. So my advice to you, really address culture within these groups. Don't just pay attention to locums or workforce stability, try to do that extra work.